Welcome to today's session titled Implementing a Scalable Strategy for Reducing COVID Infections, Hospitalizations, and Deaths Among Older Adults and Other High-Risk Populations, CV19 CheckUp. Before we get started, I'd like to go over a few items so that you know how to participate in today's event. When you joined today's webinar, you selected to either join by phone call or computer audio. If for any reason you'd like to change your selection, you can do so by accessing the audio pane in your control panel. You will have the opportunity to submit text questions to today's presenters by typing your questions into the question pane of the control panel. You may send your questions in at any time. We will collect these and address them during the Q&A session at the end of today's presentation. I would now like to introduce John Feather, CEO of Grantmakers In Aging and moderator for today's webinar. John?
Thank you so much, and welcome to all of you, and thank you for joining us. We want to thank the John A. Hartford Foundation for their support of today's webinar, as well as the entire webinar series, as well as the Center for Disaster Philanthropy and Grantmakers in Health for their promotional support of this effort today. As we all know, COVID-19 has an impact on older adults, and the public policy confusion over treatment options has shown that we need new ways to reach a much larger audience with consistent scientifically based information. CV19 CheckUp is a new consumer-facing decision support service designed to educate millions of high-risk Americans about their COVID-related risks and how to mitigate them. Today's speakers will discuss the product itself. The statewide aging director will discuss why they adopted the service, and the foundation president will discuss how philanthropy is helping to contribute to the widespread diffusion of this innovation. With us today, we're very pleased to have Jim Firman, the Chief Innovation Officer for BellAge Incorporated, Greg Olsen, Director of the New York State Office for Aging, Nora Obrien-Suric, the President of the Health Foundation for Western and Central New York, and Mary Lazare, Principal Deputy Administrator at the Administration for Community Living. We are pleased to have all of you with us. Thank you so much. As mentioned earlier, you can enter your questions for our panelists at any time in the question box on the right side. I will collect these and read these questions during the question and answer period. So Jim, let's start with you.
Okay. Hello, everybody. Thank you very much. Next slide, please. Can you hear me okay? Good, yeah. I apologize for not being on camera, but I couldn't quite figure out how to make it work, and such is the pandemic as we address these things. Next slide, please. Are the slides moving? Oh, good, thank you. So some of you may, first of all, let me begin by taking a moment to congratulate John Feather on his great leadership of Grantmakers In Aging, and really in the field, the contributions he's made in many roles has been outstanding, and I didn't have a chance to thank him before, so I salute you on behalf of those of us who work in the field. Some of you may know that I graduated from NCOA as a CEO in April to start something that I'd been dreaming about for a while, a way to take advantage of new technologies, artificial intelligence, public health, and other ways to help millions of people to age a lot better. In order to do that, we realized that we probably really needed to create two companies, two organizations to achieve scale. One is a public benefits company that will manufacture and distribute solutions, and that as a public benefits company, it's both for-profit but has a baked-in social mission. So our mission is to both achieve social impact and to do well by investors, but also then BellAge, the nonprofit organization designed to make sure that knowledge and information is available to ensure that everybody can age well. And this organization has applied for its 501c3 status, and we expect to receive that shortly. As we've looked at this, the core idea is that we can create technologies that can help millions of people to age better by giving them the information and help they need to make key decisions. And of course, that brings us to the next slide, the key decisions and challenge facing our country. This is a story that came out the other day from the University of Washington's Institute for Healthcare Metrics and Evaluation, And we are at a moment in our history right now where as many as 200,000 people are going to die in the next few months if they don't adopt safer behaviors. There's a lot of politics and controversy, and Democrats and Republicans don't agree on approaches, but everybody agrees that one thing we ought to do is help keep vulnerable populations safe. And the way that that is going to happen, and frankly, the only way that's going to happen in the next several months, is that individuals begin to adopt safer behavior. This is what the University of Washington estimates that if the one behavior was adopted of people all wearing masks, that would save 130,000 lives within the next 3 months. That's why we're here. That's why everybody here is here today. Next slide, please. The challenge that we face as a country is that there are 92 million high-risk Americans. 51 million of them are over the age of 65, and if you're in the aging business, everybody that you serve is high risk. These people need to understand what those risks are, know what they can do to be safer, and then take action. But equally important to me are the 41 million people under the age of 65 who are disproportionately minorities, disproportionately low-income people who have underlying chronic conditions, and they are also at great risk. We need, as a country, to do everything we can to help these 92 million people understand and take actions to be safe. But we can't do that in a vacuum because there are 243 million low-risk residents who need to understand the threats that they pose to others and also take action. This is our collective challenge. This is not something we're going to give up and say it's inevitable. This is something that we can do together. Next slide, please. We need to do this and with a solution that can help people one by one, millions of people one at a time, and at the same time help organizations. And that's what the CV19 CheckUp is. It's a tool, it's free, confidential, easy to use, accessible by anyone, anytime, and any device, and it will give people personal, confidential reports about their risk, what they can do to reduce those risks, and the actions they can take to address unmet needs. At the same time, equally important, it can provide government and foundations and organizations with vitally missing information about attitudes and behaviors and needs, and how do those vary by ethnicity? How do those vary by urban and rural? Where are the hotspots? Where are the messages for high impact? We cannot just do this by broadcast messaging. We have to deliver specific information to individuals. Next slide, please. The way the checkup works, many of you would benefit checkup, it's similar to that. It asks a series of questions, and based on those questions, it provides answers. We ask a few demographic questions: age, a zip code, gender, that's it. We ask questions, we need to understand whether people are worried about catching the virus, whether they think it's going to be severe if they get it, whether they are confident in their ability to take action. We ask questions about their living situation. Do they live in an apartment building? Do they live in a group home? Where do they go? Do they go to bars? Do they go to restaurants? Do they get haircuts? Those factors, those social situations all affect risk. We measure the behaviors. To what extent are they wearing masks? To what extent are they washing their hands? Are they social distancing? Are they sneezing into their elbows? To see whether, to the extent they're doing those, to measure adherence. We also look at unmet needs. We want to understand what those needs are and connect people to them. And we do also take a look at these epidemics related to mental health, anxiety, and loneliness. And these, every time we ask a question, it's a twofer. We're providing information, personalized recommendations to the individuals, but we're also generating population-level information and data for government and other organizations. Next slide, please. So what you get, this is a lot on this slide, but basically they'll get a report about their severity risk, to the extent to which they're engaging in risky activities and behaviors, to the extent which they are practicing safe behaviors, how many people they're coming into close contact with, and their unmet needs. And we'll use that to produce personalized reports about reducing your risk, being prepared, avoiding infecting others, and getting your needs met. And this is not just about education, it's about behavior change. So we want to only tell people what we think they should do, why it's important, and find the best available infographic, videos, checklist articles to help them actually take and make changes necessary. Next slide, please. So the best thing that anybody could do is actually do a checkup. Now, we didn't want to do, I'm going to run through a few slides, but if you go to newyork.cv19checkup.org, you will see this for yourself. It's easy to use. We tested it. People can do it. We say 5 to 10 minutes. Most people can do it in 4 or 5 minutes. And then you get your report. Next slide, please. And when that report comes up, the first thing we tell people about is their severity risk. This is really important. Right now, people only know whether they're high risk or low risk. I'm high risk. My daughter's high risk, but we're in very different situations. So, for example, I'm high risk, and my chance of being hospitalized is about 15%. My chance of not surviving is 5%. I need to know that when I'm making decisions. My daughter, who has asthma, is younger. Her chance of being hospitalized is 5%, and her chance of not surviving is 1%. Other people, a Meals on Wheels recipient who's multiple chronic conditions, may have a 75% chance of hospitalization and a 35% chance of not surviving. Whatever decisions you're making, it should be based on an informed understanding of the extent that you're at risk or the extent that you are putting a loved one at risk. Next slide, please. In addition to the severity risk, we then give people scores and explanations to what extent are they practicing safe behaviors, what could they do better, where are they going that may be at risk. For example, this person lives in an apartment building, they're going to the barber shop, they're going to the doctor's and dentist's office, they're eating in restaurants, and we then show people to understand what's risky, what's moderately risky, and what's safe to do. And then we also look at the number of people that you or others in your household are coming into close contact with, mitigated by a factor of whether there's a lot of community spread or a low community spread in your community. And when we tell people, next slide, please, we try to also then give them helpful infographics, things that can help them make decisions. Next slide, please. One back up. Did you miss one? Oh, no, I'm sorry, you didn't. Keep going. My fault. Next slide, please. So in addition to the risk, we then give people a series of recommendations. Exactly what can you do? Why can you do? How do you do them? And what are the resources? One of the things we're finding is a lot of people are going to places that are not safe, and they don't really realize it. Next slide, please. So we've developed infographics such as this one, which is quite popular, by the way. Many places, Meals on Wheels and churches and synagogues are just taking this one infographic, making copies of it and handing them out to all their people to help people understand what activities are safe and they should be doing more of, and what activities should they be cautious about, and which ones should they avoid if at all possible. This is a constantly moving, improving process, but this is something that people really need to understand. How do I make decisions about that? Next slide, please. So this is an ongoing system. We started this company in April. We 3 months later stood up a product, and every 2 weeks we're making it better. And it's a very good product, but it's going to be a great product. And the reason it will be is because we're not guessing about what to do. We're asking the users, the first 25,000 users, how do you like it? What could be better? What more do you need? We're constantly updating with new information and bringing on new tools. For example, we're very excited that we're going to be working with the Brown Medical School, which has a great decision support tool for very specific situations. So if I'm going to if I'm going to Thanksgiving dinner and there are going to be 8 people and 3 of them are going to be wearing masks and we're going to be there for 8 hours, what's the risk of that situation? So those are the kinds of things we're going to be adding to this tool. Next slide, please. So where we are right now is we started this company 6 months ago. We began to introduce the first services in late July and August. Right now, Florida is live, New York is live, St. Louis is live, Washington, Los Angeles, and Michigan will be live. And somebody can look at this and say, that's pretty good, you know, after you're going in 5 large markets, potentially reaching 70 million people. We have a product that's good. We have a great team working on it. It's going to get better every 2 weeks. And if this were just a straight business, I would stop and we would stop. But that's not. We're a mission-driven organization, and we understand what the crisis is. The crisis is everybody in the country needs help today. Next slide, please. So today we're taking a leap of faith, and I can tell you this is a leap of faith. This is a small company, a small nonprofit that says the needs of this nation are such that we're going to stick our necks out. We're going to commit to delivering a nationwide solution, one that will be available to everybody in the country beginning in November. In order to do this, we really only need two things. One, we need a great service so that when people come, they'll actually get help. And then two, we need to reach as many millions of people as possible, especially those 92 million high-risk people. And for that's why we're creating a campaign, and we're calling on all the sectors to help us get the word out on this service. If you are a national organization, and we just started inviting them last week, but some of the groups that have already signed on to be partners in promoting this include Mental Health America, Catholic Charities, Meals on Wheels America, National Alliance for Hispanic Health, the Association of Autoimmune Diseases, and we expect at least another 20, 30 national groups to join on. I know some of you are on this call, and the only thing we're asking is simple. Spread the word. Today, spread the word about the availability of the service in Florida and in New York, and as the other states come online, spread the word in November. Tell everybody about that word. If you are a state agency or an area agency and you're not in one of the lead states, talk to your folks about offering a state version. The state version is the best version. It can go deeper and provide more help than the national version, but at least do that. And if you can't do that, tell people about the national program. And if you're a foundation, spread the word among your grantees. If you have some you're working with now, give them a grant. Support them to do more work in this area. Or if you're interested in working nationally, talk to us about helping to get the word out, to help us continue to make the product better, or to continue to get promotion, put together this partnership. This is a doable, feasible solution. It just needs all of us to come together. And whether we serve, we're going to stand this up, and whether we serve 10,000 people, 10 million people, or 100 million people, our delivery cost will be exactly the same. So the key to this is to get as widespread utilization as possible. And next slide, which you can skip. And now I'd like to turn it over. Let me stop there for a second. What is this going to mean? If we, for every 1,000 hospitalizations that we can, for every 1,000 infections that we can stop among older people, we are going to save, if they're in the 60s, we're going to save 20 deaths and 118 hospitalizations. So we're 80, we'll save 78 lives for every 1,000 infections we stop. So this is real, whether you do it in your community, whether you do it in the nation, but we do not accept the fact that 175,000 people are going to die over the next few months. That will happen if we don't do anything. If we work together, we can reduce that dramatically. Now I'd like to turn it over to Greg, and you can skip the next slide to get to Greg. Thank you.
Great. Can you hear me? I wish I still looked like that. It's great to be here, and I especially to be on a panel with Jim, Nora, and Mary, and I want to thank John and GIA and the Hartford Foundation for having me. I think Jim did a really great overview on the tool, and I'm going to kind of provide my perspective on this, because I think that, you know, when you're in leadership roles, there's a variety of decision-making capacities you have to go through, and sometimes you see some things and yeah, it looks okay. Sometimes you see other things, you want to dig into them a little more, and then you see the no-brainers, and that's what this was. When Jim called me, kind of walked me through what this tool was. Obviously, New York was being devastated early on by the COVID pandemic, and to see the ease of use. I know there was a lot of information that Jim provided, but to really dig into this, how easy it is to use, how important it is in terms of understanding how my life impacts you and how your life impacts me, but to really do it from a thoughtful perspective, and not like, for the most part, I do a good job in, following the protocols, XYZ, but to really have to think about through 5 minutes of questioning how my behavior is going to really impact my family, my community, my friends, my region, and my state, and vice versa, I think is absolutely critical. I'm going to first start off by saying I could not be more proud to live in a state that actually takes this seriously, that comes about it from a metrics, science-based, transparency, public approach to the pandemic. I think if we had that approach elsewhere, we wouldn't be where we are now 8 months into this, but that's kind of the fact. So where are we? 213,000 people are dead today, 1,000 plus every single day, probably going right on into February, March. We haven't entered the flu season. We don't have college kids coming home yet. We don't have Halloween. We haven't had Thanksgiving. We haven't had Christmas. We are a long, long way away from this. And we are not going to move back to any sense of normalcy until we control the virus. It's that simple. And to see what's happening all across the country, again, Jim mentioned the politics. It's embarrassing that this virus has become a political tool, but it is what it is. And we got to deal with the reality in front of us. For me, the COVID-19 checkup is simple. It's a way to get back to normalcy by sticking towards understanding how my behaviors and your behaviors affect each other, and it saves lives. And that's my job, is to make sure that in public service that's at the forefront, and that's what this tool does. So Jim walked through some of the assessments that it does. It's anonymous. It takes 5 minutes to do. You can do it over and over and over again, and it's very sobering when you see the way that the data gets presented to you in chart form as some of those slides, not in text, but really evaluates my risk of hospitalization, my risk of dying, my risk as a spreader, addressing social isolation, depression, and most importantly, or equally as importantly, any unmet needs, and to really connect that to community resources. Those things are hugely critical. And so, Jim gave some examples of him and his daughter. I did the same thing when I put my information in, fairly low hospitalization and death rate, fairly high spreader rate, despite the fact that I follow the protocols pretty much to a T. Don't see many people, but I do go to the grocery store. I do go into work. I go to doctor's appointments. He mentioned the home delivered meal client. I put one of my home delivered meal clients into this, and we serve hundreds of thousands of people just like this, with 4+ more chronic conditions, who are older, et cetera, 80% chance of hospitalization, 30% chance of death. And so while the risk factors that you saw earlier on are extremely important, and that's the primary target, for me, that is not our we have two primary targets. We have those who are in the high risk category, over the age of 60, that have, the things that we've known about for 8 months, those with underlying conditions, chronic conditions, who are under 60. But as you saw from the slides, you have 243 million super spreaders out there who are walking around asymptomatic. And if we're not reaching both populations at the same time with the same message and the same strategy, we're not getting out of this. And that's, again, part of what we have to deal with in the fall. We've engaged in New York in a very aggressive outreach strategy regarding those two pieces, right? So going through, our system, the Home Care Association, working with Nora and her network, our 59 area agencies, our 1,200 subcontractors, the Department of Health, Office of Mental Health, et cetera, down the line. But this is something we have to keep in front of the public constantly. Every day, every couple of days is a new news story. And we can see by the return on data when we launch this that we have to continue to do that. We have to also focus in on who's taking it, who's not taking it, and make sure that we are covering ourselves in terms of, why are women taking this at 75%, men 25%? What do we need to do better? Cultural and ethnic minorities, how can we do that better? So we have a variety of strategies to address all of those, including getting into primary and secondary school, the community colleges, SUNYs, so that we really have a holistic approach to this. Why did we do this? This was all predictable. We knew we would be here in the fall. We knew that back in April. here we are. Misinformation. This drives me absolutely crazy that we're 8 months down the road and we're still talking about the value of masks. We're still seeing that we're rounding the corner. We're still seeing folks that just don't seem to understand that there's very few things you have to do. Masks, social distancing, good hand hygiene, and trying to get beyond the COVID fatigue, that we can get back to some place where we used to be. Until those things happen, we're not going to be back there. This tool helps you get there by, again, really analyzing and spitting back in real time your risk based on your behaviors that, again, you have to think through a little bit more. So in New York specifically, you saw some of the national data. We have 5.5 million people in that high-risk area. 3.1 of them are in my network. But again, they're not the prime. We don't live in isolation. Older adults aren't sitting out somewhere. They have kids. They have grandkids. They have communities. They're part of everything. And so this is not a one strata type of approach. It has to be birth to death and everybody in between, because that's what makes community community. We've had some questions about, is big government tracking you? Big government's not tracking you. This is free. It's anonymous. Doesn't ask your name. But to Jim's point, it really allows us to focus in on zip codes, on counties, on regions. It helps us understand people's personal behaviors and really dig down into some of the sub-tabs so that we can really tailor some public health interventions or outreach strategies, et cetera, to where we're seeing spikes. And again, outside of Maine, New York has done the best job in staying at 1% or below, but we're seeing spikes too, just like everybody else across the country. It takes 5 minutes. We spend more time looking up microwaves and toasters and other types of things than we do about our public health and resources that are local to us. 5 minutes of your time. You can save it on your desktop. You can save it on your iPhone. You can take it every single day, as many times as you want, into the future. And again, it provides an opportunity to target some relief and really calculate and look at some of the data. So this is a life-saving tool. It's not, for those of you who haven't taken it yet, take the 5 minutes to do it. This is something that leaps off the technology page, and to me was a no-brainer, both in terms of my population, but in terms of somebody that has kids in school, why that's valuable, and everybody in between. So if you could go to the next slide, we'll just take a look at the first weeks of data. We had an initial launch, and we had almost 6,000 folks take it immediately. And we've been working with Jim and his team to really sub-tab this. So we have a lot more data coming, but you just take a look at this. Not surprising at all. Most of the people that we reached were over the age of 50, but I was pretty happy with the 25% in the first week under the age of 50. Again, that gets to the dual purpose of what we're trying to do. Females primarily took it. That's not a shocker to me, but we have to have a strategy to figure out how we go about reaching men, and we've developed that. Non-white respondents, again, not a surprise to me. We're working with Governor's Office of New Americans, Governor's Office of Faith-Based Initiative. It's 5,300 different faith-based communities so that we can really target that intervention to those hard to serve. Then we work with folks like Nora and others who, we have a very large community footprint that we need to get this out there so that we can skew those numbers, because as we know, cultural and ethnic minorities were particularly hard hit and are the essential workers and who are really succumbing to the virus. I like the insurance question because I didn't think about this, but in the first week, who did I send this to? I sent this to my network. I wanted them to make sure they got it out. So who took it? My network, people who were employed, right? 70% private insurance. I want to see these numbers change significantly. I want the Medicare number to go through the roof because that's who the folks are that we primarily serve. And then working with our other departments to see that Medicaid number go up. I have no issue with the private insurance high, but that says to me it was people already in my network who, are paid to do the work on our behalf that took this initially. Next slide, please. Thank you. This is good because when you dig down, this is what I'm talking about in the sub tab. When you take the tool itself you will see all the different data elements that then you can cross tab with a variety of other things. But a lot of people do a good job most of the time in wearing a mask, but then you start to dig down in it and you see areas of concern. People are still hugging and shaking hands. I got to be honest, I do that from time to time, right? 52 years of hugging and shaking people's hands, it's hard to undo that, but we have to undo that. So what Jim's tool does is it spits that out. You need to focus on these risk reduction behaviors. Washing hands. So I find this stuff fascinating, but it really tells us where we need to focus our attention, to continue on the outreach and education, to make sure that we're not all COVID fatigued, because we are. But if we throw in the towel now, we're not going to be in good shape when we're only in October, coming into some of the worst months. And then you see some of the behavior drive risks. And I believe we have one more slide. People think they're going to get this. That's crystal clear from the data, but they are not sure what they're going to do, how they're going to deal with it. And so again, I think that these are really important elements in terms of how we get information out there. One of the most important pieces to this, we knew social isolation, depression, anxiety was a public health epidemic prior to COVID. Everybody knows it now. It's unquestionable. This tool is extremely important. States like ours, we had over 7,800 mental health professionals volunteer their time to man a mental health hotline just to connect with people. Organizations like Nora's, ours, our network, we're making phone calls, we're visiting people. Everybody is building up their technology platforms. This is going to continue to be a huge problem when you're dealing with economic problems, people at home with school, people not sure where their jobs are going to be, stimulus that doesn't exist anymore, wondering how you're going to put food on the table. We've seen child abuse, elder abuse, depression, anxiety, suicide, all go through the roof. And not only is this tool critical in analyzing the risk and behavior, but the connectivity, like we did in New York and New Yorkified this, to local entities that can really assist and intervene is absolutely critically important. So my job here isn't to sell you on this. I've already been sold on this. It's critically important. There is a model that's national. That's great. We launched this, and as I mentioned, a couple of other states, and we New Yorkified it. It was Floridified. It was Michiganified, and every other state in the country. If we want to save lives, and if we want to look at an intergenerational approach to make something happen to get out of this nightmare that we're in, the COVID-19 CheckUp is a very, very low-cost way to do that. And with the partnerships I think we all have, whether you're a grant maker in aging or a grant maker anywhere else, there's connectivity, there's resources that we have, there's people that we know personally on our own Facebook pages, our social media, and everything we do in life for a living that we can get this out. And at the end of the day, this is about saving lives for me. I was proud that Jim called me first, and this was a no-brainer. That's it for me.
Thank you, Greg. So passionate, I appreciate this. So I'm Nora Obrien-Suric, president of the Health Foundation for Western and Central New York. And I'm going, in my brief remarks, I'm going to tell you two things. I'm going to tell you personally why this COVID-19 checkup is important to me. And then, of course, I'm going to tell you professionally why this is important to me and to the foundation. So I am the oldest daughter of 5 in my family. I am my mother's healthcare proxy and her primary contact for when she gets sick, which she never does until COVID. My mom is 86 years old. She is extraordinarily healthy, irritatingly healthy, stubbornly independent, and she's driving, she's cooking, she's taking care of her friends who aren't as healthy as she is, who are both younger and older than she is. And this is her life role. She prides herself on being so healthy and independent. But COVID hit and she had to be social isolating and she got lonely. She's not used to being alone. She likes to be surrounded by people and she started to get depressed. My mother never gets depressed. So what happened? She started taking risks. As time goes by, she's not getting sick. She doesn't know anybody who's getting sick. So she started going back out, visiting with people, maybe wearing masks, maybe not. Then my cousin, who moved to Florida several years ago, was also getting lonely, and she missed her family and her cousins. And so she drove up from Florida with her teenage son and went to visit our cousins and my mom. So my mom embraced her literally. They had lunch together outside, but they sat close together, not wearing masks. And my cousin left and went back down to Florida. And 1 week later, my mother went into the emergency room because she had heart palpitations, atrial fibrillation. And in the emergency room, they tested her for COVID and she was positive. And they admitted her right away. She started to get symptoms within 2 days. She was very fortunate that she was already healthy, even at 86 years old, and that she was able to get remdesivir. But I'll tell you, it was 3 weeks of touch and go. It was horrible. She did survive COVID, thank God. But then you can imagine the stay in the hospital decreased her mobility, her ability to walk. She had to go in for rehab. It was really hell for me, but for her, and for all the family being terribly, terribly worried about her. My cousin, when she found out my mom tested positive, went and got tested. She tested positive. Asymptomatic the whole time. She had to get several COVID tests before they allowed her to go back to work. She was asymptomatic the whole time. Her son, asymptomatic and tested negative. So she was a super spreader. And my mom was one of the casualties. Thank God she is fine. So, but now my mom, who's well recovered and, being more careful, but she tells me now, she says, I deeply regret that I took that risk. If I had just been a little bit much more cautious and knew the risk factors, then I would not have done that and put my whole family and herself through this. So that's my personal story of why this is important. If I can get everybody in my family and my cousins to be able to take this and know their risky behavior and the risk that they might have, not only for themselves getting sick, but for spreading it. So obviously, professionally, you know why I'm interested in this. We're a health foundation. We care about the health of our community. The Health Foundation for Western and Central New York, we cover 8 counties in Western New York and 8 counties in Central New York, 16 counties altogether. Our focus is threefold. We focus on children who are vulnerable, older adults, of course, and also helping to serve and to build capacity in the organizations that serve both of these populations. So health is important to us, health outcomes is important to us, and reaching the populations that are vulnerable in our areas, and most of our counties are rural. So making sure that we can get the word out is really important. We also focus on caregivers of older adults. So we're always looking for ways to be able to reach out to caregivers and to support them as they're caring for older adults here in our communities, but also wherever their older adult relatives are living. As in my case, I'm my mother's in New Jersey, so I'm a long distance caregiver. And as you all know, if you're caregivers yourself, you know that whether you're long distance or close by, it's still a heavy lift, especially when someone is desperately ill from COVID. And I wasn't able to see her anyway, so everyone's long distance at this point. So when I heard about this new tool, COVID-19 CheckUp, and Jim took me through the steps, and I'll echo what Greg is saying. Highly accessible, easy to do. So I thought this is perfect. Now that I know about this, it's my job, really my obligation to the communities that we serve to inform older adults, to inform the caregivers, to inform all the professionals. So that's my role now as a professional in this area and taking our responsibilities quite seriously. So what are the next steps? As Jim said, spread the word. How do we spread the word? Reach to people who need it, get the word out. So Greg's already mentioned that, we're working closely together. The Health Foundation has a partnership with the New York State Office for the Aging. We have statewide initiatives that we're helping to incentivize, from age-friendly communities, age-friendly health systems. And through these partnerships, not only are we working very closely with the New York State Office for the Aging, but also the New York Department of Health, the health associations, healthcare associations in New York State, and the Community Health Center Association in New York State. And these are our dear and trusted partners who we know will be very interested in knowing about this tool and getting it out, not only to the organizations that we're working with in our initiatives, but also to all their other constituents and partners that they have. And of course, our foundation partners. You know, every foundation that I know works in partnership with others. And we are very much in alignment with making sure that we partner and that we actually can leverage the funds that we have, but also the human capital that we have and the momentum that we can gain from working together. And honestly, if there's some silver lining in COVID, which, you know, you have to look hard to find, but what this has done is in both regions, in Western and Central New York, the funders have come together and formed a consortium. And I know that this has happened also in other places around the country. So we meet on a regular basis. We're pooling funds specifically to make grants to help organizations and deal with COVID and to make sure that they're able to support the citizens in these communities. So I'm so anxious to bring this forward to my foundation partners. We've got meetings coming up. I've already been in all the meetings I've had so far. I've been mentioning this, and we're going to look for ways that we can help disseminate this information to make sure that the tool gets into everybody's hands who can use it. And then reach down to all of their grantees. As Jim said, reaching out to grantees. We have hundreds of grantees, you know, in all of the 16 counties, and that we're definitely going to reach out to. We're focusing on the caregivers. So we've got a lot of respite programs that we're working with, faith-based organizations that are providing services for caregivers, disseminating information, working with senior centers, the area agencies on aging. Greg and I have already had conversations about how we're going to help the county offices for the aging in New York State, and especially in, well, all over, but we'll be focusing on the 16 counties where we can provide grants. But as we know, grant money helps a lot, and we're going to look for ways that we can provide incentive funding for organizations to be able to take this tool and spread it and use it to disseminate. But it's also not just about grant making, right? It's just getting the word out and working with partners. Our board of trustees are going to be very interested in this. They've been really, all of us have been just very sick over the amount of people who are impacted by COVID, people who are getting it, people who know people who are getting it. One of our trustees lost his mother-in-law and her sister to COVID within 5 days of each other, and they couldn't attend the funerals. And this is devastating for people. So, and we're also, the Health Foundation has Health Leadership Fellows, and we've been providing collaborative leadership development for 10 years now. So we have over 300 fellows now in our counties, and these are decision-making people in the community-based organizations that are critical mission to our mission. And so we've got a Fellows Action Network newsletter that comes out on a regular basis. So we're posting it in that as well. We have a fantastic team. So we'll be putting this on our website, linking to this COVID-19 CheckUp. We work with radio stations in both regions. We support their older adult news desk. So we'll be talking with them. And of course, we have a relationship with newspapers and health newsletters in the area. So that's what we're looking to do, in addition to seeing how we might be able to provide funding as well. And as you know, those of you in foundations, that you need to have your board to review the proposals. So we're not at that stage yet, but we'll be talking with our board of trustees about possible funding initiatives that we can provide. So that's what the Health Foundation is looking to do. We've already heard from what other foundations are doing. 2 foundations have already made commitments to support the rollout of the CV19 CheckUp, and a few other requests are currently under consideration by other foundations that we know of. The Michigan Health Endowment Fund is providing $70,000 to support the development of more in-depth data and analytics to inform state policymakers on key differences among key population groups. And you saw that in Greg's slides about the different population groups that are important to reach, such as also the rural versus urban minorities. We're also looking at the Health Foundation on our new strategic plan, which is focusing on diversity, equity, and inclusion, and reaching out to those communities that are underserved, that we know have severe poor health outcomes, and also to look at reaching people of different ages. So the Michigan Health Endowment Fund is working with their State Office on the Aging too in disseminating this information. The Patterson Foundation, who I know is also listening, is providing $50,000 in general support for the campaign. And BellAge and Aging New York are welcoming any other inquiries from other potential funders about how you might want to be able to support this, whether it's national, regional, as we are, locally. So as Jim and Greg have already said, and I will echo, this is really easy, it's free, and we encourage you to consider how you're able to take this and disseminate it among all of your constituents as well. Just want to thank BellAge for developing this and making this available for free and looking for ways to really get it into the hands of people who are able to make a difference. And thank you for Grantmakers in Aging for making this webinar available so we can get the word out. And now it's my pleasure to turn this over to Mary Lazier.
All right, thank you, Nora, appreciate that. And representing the federal government and hoping to keep my job for a little bit longer. I can't come out and say, hey, ACL or HHS endorses this product, but we certainly did appreciate the opportunity to hear from Jim and learn about it. And of course, it's a great opportunity to hear how it's being used, and we applaud all of the efforts. I will share very briefly with all of you that we know how technology can impact the lives of older adults, and as well how the lack of technology impacts the lives of older adults. I just want to share with you very briefly, ACL has sponsored what's called a prize challenge with the Office of Science, Technology, and Policy at the White House. This prize challenge is addressing what you have all talked about, social isolation. We have partnered with the Office of the Assistant Secretary for Health because social isolation impacts so many facets of health, behavioral health, physical health, spiritual health. And so we know that this pandemic, as Jim and all of you are addressing, how can we use something to address the impact of this pandemic on older adults? We're looking to have this prize challenge address a platform that will serve as a clearinghouse for products that mitigate social isolation and provide connection and connectivity for older adults. So we are in phase 2 right now of this prize challenge in working with the White House. They asked us, can you get this set up quickly? We did, in partnership with OASH, in partnership with Veterans Administration, in partnership with the FCC, Federal Communications Commission, and with the Consumer Technology Association Foundation. So these partners have all worked together to set the guidelines, do the judging for this competition. You may look to challenge.gov to see this. It is titled Mental Health. Mental is an acronym for mobilizing and engaging the nation and technology to address loneliness. So mental health is in challenge.gov. You will see that. And one of the things that we're looking at is how do we take an assessment of an individual and have that assessment guide them into this platform and allow them to see resources. And when I say these resources on this platform, we are talking about even what's called legacy technology, using telephone, television, and radio for those who don't have broadband access. What programs, services, what are ways to connect with this? The platform would give people local information about programs, services, but as well tablets, apps, other forms of technology that enhance social connectivity and engagement. So I want to share that with you in terms of what is ACL doing in terms of technology. We have also worked with a coordinating body of many different organizations, about 14, 15 different organizations who have been meeting weekly since April to address social isolation. This group has identified that they need a campaign. They will talk about this platform. They want to do all kinds of things that will inform the public about what resources are out there for older adults relative to certainly the pandemic and beyond, because we know people are in social isolation even beyond a pandemic. So we're looking to have that addressed. We are just recently have joined forces with the Coalition to End Social Isolation, which also brings an international factor and knowledge translation and transfer to us. So there's lots going on in this space. We hope to have the winner announced in December. And actually, I'll take that back. They will be announced at the Consumer Electronics Show, CES, in early January, very early January. We are also working with a partner that I'll call the implementing partner, where we will take the platform, the prize winner, work with the implementing partner to make this public facing within a matter of 6 months, hopefully. So the prize challenge is a total of $750,000. And we're very excited that we had six great honorable mentions, 2 that have progressed to phase 2. And again, at CES, they will be announced. So there are lots of opportunities, I believe, for the kind of work that you all are talking about to interface and complement one another in the work that ACL and our partners are doing, and all of the body of this coordination collaborative are doing to address social isolation. So thank you for letting us be part of this. We applaud the efforts that you've talked about today and appreciate the opportunity as well to share this information with you. Thank you.
Thanks so much to all of our speakers. We've got time maybe for 1 or 2 questions. So Jim, I'm going to address this to you. We know that the product is free for the consumers, but the question was, do you have an estimated cost if someone wants to have you come look at setting this up on a statewide or regional or citywide basis? Do you have a sense of what that would cost? Jim, are you there?
Hello, can you hear me now? Sorry about that.
Hey, yes, we
yeah,
can.
I apologize that. So the pricing, if it's a state wants to buy, it depends on the size of the state. The largest state, it's $45,000. For states with less than 1 million people over the age of 60, it's $35,000. And for states with less than 300,000 older people, it's $25,000. We are not pricing this. This is a bad business decision to make available a free service. Let me be very clear about that. We are doing this because we believe that this country right now needs to step up and put aside even things like prices to get this out. So I've been advised not to do what we're doing, but I don't care because I'm here to save lives and people are here to save lives. But that's what it costs, right? If a state wants it, and we're happy to talk to any state that wants to use it.
Can I jump in on that? Because
sure.
Can I jump in on that quick? Because you don't often get an opportunity to have 19 million people access something for $40,000 and make a good investment. And I'll tell you this just on the side, I've paid consultants $50,000 and gotten nothing back. This is a tool that is going to save lives. I mean, that's why, I had said earlier, this was a no-brainer. I had committed to this before Jim jumped off the phone during his demonstration because it was affordable and it saves lives and it matters.
And a number of you asked if there was a place that you could go see this. And in fact, the thing that's on your screen right now, the questions and discussion, the first thing is a link to the New York system. So you can go and take a look at it yourself. You can, I'm sure, sign up and also use it. So let's see, we have a couple more. Mary had already said a few words about the issue of access to broadband and other resources, but a couple of other questions. Is this currently only in English, and is there any opportunity to expand that to other languages? So Jim, probably back to you.
No, it's available as of either later this week. The Spanish version will be available. So it's available in Spanish and will be available nationwide and all the states in Spanish within the week. We are also hoping to do other languages and can't do it yet. But we also, I want to say one thing, we are equally committed to people on the other side of the digital divide. We've had experience with Benefits CheckUp. This tool is designed to be used not only by older adults, but by family members, by professionals, by volunteers. Telephone helplines can do this. A lot of people who have been volunteers find they can't go to their senior center. So this tool can work telephonically, and a report would get generated and printed. We will not succeed as a country if we don't find workarounds for those people who are on the other side of the digital divide.
Well, thank you so much. We're now to the point where we're going to ask each of our panelists to give us their final words of wisdom about this. So, Mary, let's start with you.
Got to remember to unmute. So I would just say to all of you that are in the audience, I think it's a great opportunity for you to hear all that's available and to share that with others. And I think that as far as hearing about technology and what we're doing to address the pandemic, I just want to applaud everyone for their efforts, and I'll leave it at that, John. Thank you.
Thank you very much. Nora?
I would just like to raise the issue of ageism. And we saw how covert and overt ageism attitudes have really had an impact on older adults and how they're being treated during this COVID pandemic. It's really atrocious. And I think that addressing ageism is incredibly important for all of us, and to call it out when we see it and when we feel it. And I feel that this tool basically takes ageism out of the equation because it's easy to use, it's multi-generational, it can be geared towards caregivers, and so it's one way to really help address the issue of the pandemic and the impact on older adults, because it hasn't been addressed enough that I've seen in this country. So thank you for making this available.
Thanks, Nora. Greg?
I'm just going to ask that folks on the line do three things. Spend 5 minutes, put your own information in there, and then be wowed by what you see back. If you have kids or grandkids, have them do it as well. Be honest about it. And then if you have somebody older in your life, do that as well. This has nothing to do with them. This is about us. And we're all in this together, and you're going to be shocked by what comes back, and the shock factor should make us spread this and try to get us back to some place that we used to know, hopefully sometime in 2021.
Thanks so much, Greg. Jim, last word for you.
We can do this, guys. Together, we can save tens of thousands of lives. It's not inevitable that this spread is going to continue. I don't care what people say. It's up to us. There's nobody else. We are here. We have the tool. Between us, we have the network, the mess, and the credibility. It's going to take the public sector, the private sector, the faith-based communities, and all of us, the companies. But this is a solvable solution. We need your help. Let's do this together, and let's save a lot of lives. Thank you.
Wonderful and inspiring words, Jim. Thank you so much, and thank you for your leadership of this. I want to thank Jim Firman, Greg Olsen, Nora Obrien-Suric, and Mary Lazare for their contributions today and for all the tremendous work that they do every day to make life better for older people. I also want to thank the Johnny Hartford Foundation for their support of this webinar and all of our webinar series, and the Center for Disaster Philanthropy and Grantmakers in Health for their promotional support. We will be making today's presentation available to anyone who wishes to view it later, both the slides and the audio. Please watch for an email to be sent out within a few days. And please join us for our next Conversations with GIA webinar on November 10th, Rural Transportation Connects. To learn more and register, please visit our website. And finally, I want to thank all of you for participating in today's webinar. Please stay safe.
Thanks, everybody.
Thank you.